Well, the essence of big data is really knowledge. I mean, if you run a hospital, imagine what it could mean for your staff and your budget if you know who's probably going to come through the door, if you can reach out to them and help them identify their condition before it becomes critical, if you can use it to make your supply chain more efficient, if you can look at your regulatory issues and your procurement issues and use big data to help in all of those, you can provide better care for less money in a more timely fashion with a higher quality of life for your patients. Well, like in a lot of industries, a lot of knowledge is still very siloed. So the first thing you could do in healthcare would be to just take the doctor's notes, patient surveys, the outcomes of pharmaceutical treatments and things like that, and just combine that, right? So then at least you start to have a little bit more comprehensive picture of just that individual. And after you do that for a year or two, then you can start to look at that department that provided that treatment in that hospital or in that institution. All of a sudden you have a very valuable set of data where you can look at the effectiveness of when were certain pharmaceuticals introduced. Should they be introduced later? Should they be introduced earlier? Did they have more of an impact on older or younger? There's huge amounts of knowledge that can be gleaned from the use of big data in healthcare.